joining us today for our town hall, not if, but when COVID-19 arrives at your center. A little ominous, I know, in the title. We do have more participants who are joining, and in a few moments, I will be introducing you to our special guests, Kim Pomeres, Francis Powell, Herb Ego, and Charlotte Cacco, who all have agreed to join us and talk about both their stories and as well as their guidance and support. So thank you again for joining us today. We are going to keep this to about an hour in time, and just so we can do a little upfront housekeeping and a little bit of support, one thing I wanted to direct you to is you'll be able to ask questions through the Q&A button on your screen. Please use that. Please do not use the chat feature. We'll try to redirect you back to the Q&A. Today, we have a special guest in the sense that our IC360 PR Crisis Support Leader, Charlotte Cacco, is with us, and she will be answering any questions you may have during the session. So if you do have any questions, please put them in the Q&A. You can ask her directly or privately, but you also will be able to ask for the general audience, which we suggest you do, so everybody can get the benefit of her answers while we continue to talk. These programs and these executive pop-up webinars also have a certificate that come with it. So since you have registered, you are eligible to receive a certificate. And for any reason, if you're having any issues outside of that or a question, you can chat with Hans, who heads up our marketing and puts our programs together. So with no further ado, we will move forward, and let me go ahead and just do one housekeeping item before we introduce our panelists today. So some of you have seen this before, but want to make sure that everybody is aware we're very excited about one of our key programs that IC360 has been rolling out. This is our IC360 ECE Healthy Advantage. This really fits what we call the donut hole of healthcare for childcare ECE staff members, whether those are covered by a high deductible major medical plan, or they don't have access to a plan, or you're seeking to have a healthcare program that's more cost effective and more flexible. We have a program that might be absolutely perfect for you. We did a lot of research over the past 2 years. I've worked hard on putting together a plan for all of our members, as well as this was one of our first programs for non-members. This program is something you can have to offer significant health benefits to your teams, your administration, and even yourself if it makes sense. The program itself is something that is highly affordable. And what that means is, coming out of a paycheck, if an individual is paid every week, their fee may be only from as low as $11.50 per an individual, but all the way on the high end, you maybe $90 for an entire family. But there is no high deductible. From $1, they get a lot of benefits. There's 5 different types of plans. All of the plans include a telemedicine that has no copay cost to it. So you always have access to a doctor too. This is easily implemented, the plans. We have also paired into it an enrollment specialist and the enrollment center online, as well as an online app that allows all your staff to know the benefits, understand what the cost of any appointments would be, work with the claims team. So it takes the burden off of your administration, and it provides a lot of flexibility. It is oftentimes, hopefully, just what is needed. And what we mean by that, a lot of people, especially the younger generation of 25 to 35, oftentimes feel like they really don't need a healthcare plan. As we well know that you do need healthcare plans for sure. And it's challenging for a number of reasons, but also from an ownership standpoint. If you happen to have more than 50 FTEs, then you must provide one according to the Affordable Care Act. And this meets a substantial component of the Affordable Care Act. With $15 office visits, $15 visits for specialists, having $50 urgent care visits, having a lot of discounts for pharmacies for tier 1 and tier 2 generics, as to tier 3 and tier 4 branded pharmaceuticals. Very competitive prices that are unlike anything in the industry. And the way we're able to do it is because we specialize in the ECE childcare industry. We have a whole bunch of members that allows us to have the buying power to put a program like this together. I have it for my 3 centers and for all of my staff, is very friendly to this. So we speak in terms. For instance, when our benefit enrollment specialists that work in our program, and this is working with the provider, so we're not doing it ourselves, we work with a benefit provider along with a broker, as well as with others. This allows us to have us talk about when people enroll would be after hours, typically, talks because teachers are in ratio and what have you. Then it also delivers hopefully a lot of value because it gives them access to a lot of local physicians. We're there to serve our members, so it's a very trusted program, and hopefully we see ourselves as being very knowledgeable and helping bring that knowledge to you folks on these programs. So enough of that housekeeping advertisement. What I'd like to do is ask our team of panelists to come on just for a brief moment, on video at least, and I'm just gonna do a quick overview introduction of them. And thank you very much for joining. We have Kim Palmieri with Courthouse Academy. Kim, you want to wave to us just so we know which one is you? There we go. Herb, how are you doing? Great. And Francis, we'll be talking to you in a moment too. And then at the very end, Charlotte will be answering any questions you may have. And we'll be talking at the end with Charlotte too, as our PR crisis specialist. So Kim, if you want to come on with your audio, and Herb and Francis will talk to you in a moment. Kim, how are you doing?
I'm doing very well, thank you. How about yourself?
I'm doing great. Thank you so much for joining it. And guys, I think you know that I'm not the most formal kind of person on these events. And Kim has become she's not only a member, but she's become a very good friend of mine, in the sense of we've gone through we've shed a lot of tears together. Let's put it that way. And she's had some wonderful experiences that I've learned a lot from her. And hopefully I've been able to part a few little inklings of ideas with her too. But Kim, if you don't mind, just tell us a little bit about you, your center quickly, and then let's get into what happened.
Okay, again, I'm Kim Palmieri. I own Courthouse Academy in Virginia Beach. I opened it in 1992. It's a Spanish immersion school. We take infants through 5th grade. And I guess that's pretty much it for the school. What happened was several Mondays ago, we got a phone call from a mother saying that her child had gotten COVID. We had siblings in the school as well. So the director, my director is Julie, and she immediately called the health department for guidance. And they gave us a number of scenarios. It wasn't real explicit what we should do.
So they didn't tell you that here's a plan. They just basically left it up. They gave you a few.
They kind of went, well, you could do this, or you could do that, or you could do this. So it was not really what we thought we would get. We elected, and in retrospect, we would not do this, but we elected to close the school for 2 days. We immediately notified the parents through email, and we used Brightwheel. So we closed. What we were told was because what they described was contact was physical contact for 15 minutes or more. So they did not consider that anyone actually had true contact. And so there was no need to quarantine, but everyone involved needed to self-monitor, except obviously the child but the child was not in the school. She had not been there since, I think, Thursday.
So just a logistics question. Mm-hmm. You discovered by mom calling you and telling you that the child had tested positive for COVID?
Mm-hmm.
Okay. when you did do that, what was your turnaround time for reaching out to parents? Approximately how long from the time between the time you found out, the time you called the Department of Health to the time you reached out to parents?
It would have been I was not there. So it probably would have been within an hour. I mean, as soon as Julie knew what the health department had to say, we made the decision to close for 2 days and the email went out immediately.
Okay. And when the email went out, how did parents handle it?
Well, here are a couple things I learned.
Okay.
One, the parent that contacted us, if it happened, or not if, when it happens again, we will ask them not to post it on social media.
Oh, okay. So they posted on social media saying that their child had COVID and where they went to school.
And parents went, you know, they did what they do. So one other thing that we would do differently in the email, we sent out an email saying that we had a case in the school and what our plans were in the future. And then we directly contacted the parents of children who were in that classroom.
Okay.
What we would do differently is we would send out a blanket email to everyone saying that essentially what we said, but we would also say in it, we will be contacting you directly if your child was in the class, and please do not respond to this email.
Okay. Now, why do you say please do not respond? Because a lot of people did respond to the email?
Because we had an absolute flood that we couldn't address. We couldn't, flood. And phone calls of parents saying, was my child in that class?
Right.
So by putting in the email, we will notify you directly if your child was in the class. Hopefully we will avoid the phone ringing off the hook and the emails, just slamming us. We couldn't respond.
Okay. So you guys weren't even able to respond and you're trying to get it. And how was I'm sure it was all over the place, but what was the temperament of the parents overall? Were they understanding or were they just panicked?
Mine were panicked, and for us, I've talked to other people who have said parents expected it, they were ready, they were fine. They said you've gone so long without. Not my parents. My parents lost their collective minds, and we actually over the next 2 weeks had 50 children pulled out for the fall. Wow,
that's huge. I'm so sorry to hear about that, Kim.
Yeah, we've been on quite a roller coaster, but yeah, they lost their minds.
Yeah.
I wouldn't, if you're listening, I wouldn't automatically panic about this because I have heard many people say the parents were like, hey, it was going to happen. I just have special parents. I don't know.
So what would you do different?
Well, the things that I outlined, I would do differently. The other thing is I would not close the whole school.
Okay.
There was really no need, but we were trying to be proactive.
Right.
But parents were upset anyway.
Right.
So there was no need to disrupt that many families.
Yeah.
In the future, we would simply close the rooms that were affected.
Yep.
And again, because it would be a case of everyone needs to monitor, unless other than the children or teacher or whoever actually has it, they obviously have to go. But everybody else does not. They just have to self-monitor.
Did anybody else come down with COVID that you're aware of? So no one else did. So there was people were panicking. Their arms are up in the air, running in the street, basically on your center.
Yeah. Can you see the picture?
Yeah, and unfortunately, it did. Obviously, it hurt you guys. Do you feel that how do you feel like if it did anything to your reputation for your business?
I don't think it really negatively impacted our reputation because we've had this one case. Since the beginning, we never closed.
Right.
And I trying to deal with it. I did get to thinking about, it actually helped people pull who were probably going to pull come September.
Okay.
They clearly, by one child being in the school, it hit their major panic button and they pulled their kids. If we had gotten this case in September or October,
still gonna happen.
Yeah, yeah. So we now at least have the opportunity to recoup
Okay.
somewhat, and we're enrolling.
Sure. Well, I'm really good to hear that. I know you've grown tremendously in the past, 2 years or so. So I know you'll get right back up there. One last question for you before we move on to her. Um, did the press become aware of it, and did the press contact you on it?
No, no, we
No?
were not ever contacted.
And one last thing is, how about with your staff? Did your staff have any significant concerns, or were they all part of Teen Courthouse Academy?
Most everybody was part of the team. We had a couple, because we cleaned ourselves the next 2 days. Had a
Right.
couple who were like, well, I don't, they came up with a sudden illness. And Julie did address them and say, look, we're all part of the team here. The team is here to
Great.
do this. And you can elect to stay home, but that could impact your position in the team in the future. And suddenly they did. One actually came in and apologized, said, I was just panicky. You're right. I need to
Wow.
be here. Yeah.
Well, Kim, thank you so much. I'm going to ask you, when you go off onto video and you go off on your audio, if you don't mind, if anybody in Q&A wants to ask Kim any direct questions, just please put her name up there, and I'm sure Kim wouldn't hesitate to respond to you. But Kim, thanks for taking a little time right here for this. And Herb, if you don't mind coming on, that would be great. There we go.
Hi, Anthony.
How are you, Herb?
I'm good, thanks.
Great. Herb is one of my peers in the Western New York region, where I have 3 centers. Herb, you have 1 center. Tell us just a little bit about your background too, quickly.
Yeah, real quickly. I mean, most of my career was in manufacturing, actually. I was a sales and marketing guy. Most of my work was outside the United States. I traveled all over the world doing international business development. I got tired of traveling around the world, so my wife and I started a Doodlebugs franchise in 2012. So
Great.
just to give you an idea, we have, we're licensed for 168 kids. We currently have probably 110. We have 42 employees, so it's a pretty good size center.
Yeah, it's a beautiful center too, because I get to drive by it once in a while too. But thank you so much for coming. Herb, why don't you tell us your story?
Yeah, what happened really could happen to anybody. We had, similar to the previous story, we had a parent call us and tell us that she had been contacted by the contact tracers.
Oh, okay.
And was made aware that her and her child had been exposed to someone. So she called us, and I said, well, you pretty much got to come get her. So she immediately picked her up. They went and got tested. The mother was negative. The child was positive. Of course, like all these tests, it takes days, and you can't shut your center down every time somebody comes in contact with somebody who might be. So you kind of have to wait for that positive test. So there were a couple days in between. We actually got a notification on a Sunday night that she tested positive. So we immediately sent an email out, 2 emails, one a general email to the parents in the center, and the other one a more specific email to the parents that were in the class that the child was in. Actually, my wife and I immediately went to the center because the cleaners were there, and we literally had 4 people in that one classroom cleaning absolutely everything stem to stern. We shut the classroom down for 2 weeks. We did not close the whole center. We have Watch Me Grow, one of the video watching services. So we actually used that to see who else that child might have come in contact with. The health department here basically said anyone with whom they've had close contact, and they sort of defined that close contact as within 3 to 6 feet of that person. So in addition to the people in her room, there were a couple that she played with on the playground, and I think somebody she hugged on the way in. So we literally, had to watch 8 hours of video footage to figure it out. But by the time we called the health department the next morning, we had the contact list pretty much ready to go.
Well, what's interesting is from Kim, they said 15 minutes of touching for exposure, and in New York, it was 3 to 6 feet in distance to them.
For any length of time. I mean, just like I said, she hugged one child when she came into the building as they were passing in the hallway, and we had to give that child name for contact tracing.
And did anybody else get COVID in that classroom?
No, actually the girl was completely asymptomatic. And I think that's the point of this case. There was nothing differently that could have been done. The mother filled out the survey when she came in. The mother had a mask on. The child had a mask on. Actually, when she got into the building, she didn't have it on in the classroom. The teachers had masks on the whole time. So she was completely asymptomatic. There was really no way to know. And fortunately, no one else tested positive, not the children or the teachers.
Well, you know, and I know, so then getting into the bigger piece of this, because the way I found out was the media, the press.
Right.
So tell me a little bit about that experience, because that didn't happen to Kim.
Very disheartening, actually. We sent out what we thought was a very thoughtful email to the parents with a letter that was attached from the county health department indicating what happens, right? How they're going to be contacted for contact tracing, et cetera. And one of our parents leaked that email with the attachment from the health department to the media. So the media actually called the health department in the morning looking for details. And then we got tipped off actually by the health department. They called us right afterwards and said, hey, the media's on this. So then, you know, we had to get scrambling. It turned into a circus. I mean, we had 4 different networks calling us all at one time. It seemed absolutely incredulous to me that one little asymptomatic girl in one little suburb turns into evening news, but that's what happened.
Yeah, and so tell us a little bit of that, because we're talking to peers of you and myself out there. You know, how did you handle it when you were getting all of these calls from the media? What was
You sort of gotta immediately decide whether or not you're going to comment or not. And so,
Right.
you know, I spoke with the station manager and I said, you know, you're going to run this story whether I comment or not. And he said, yep. And I said, well, in that case, you know, I'd rather comment because I'd rather be transparent and make sure everyone's aware of what's going on. And I also felt some obligation to let other business owners know that you can do everything right, follow CDC, state regulations, health department, do everything right and still have this occur. So, so you have to be prepared, or better prepared than we probably were.
And in your comments, you know, I read them firsthand and I thought they were very transparent. I thought they were well organized. How were they received?
Actually, really well. I mean, I got to be honest with you. We lost 6 customers. If you consider we have 168 families, that's not a lot. It's painful. It was expensive for us because we didn't charge the parents who were out on the quarantine. And obviously we paid the salaries of the employees who were out on quarantine. So between, you know, the 6 families that we lost, 2 weeks worth of revenue for that classroom and 2 weeks of salary for those 2 teachers, you know, that's setting you back on an awful lot of money. So, I mean, one lesson learned, you know, have some money set aside because there is a cost to all of this.
Yeah, no, absolutely. Is there anything you would do different?
Well, yeah, now, I mean, hindsight's always 20/20. I mean, we're redefining our center policies, which I would encourage everyone, they have written center policies, to take a look at that, because we're going to change our center policies so that if there's another quarantine, that the parents will have to pay during the quarantine period. We don't feel it's appropriate for us to be financially responsible for this when most of it's outside of our control. So, but on the first go around, it wasn't addressed anywhere in our policies. So I felt that the right thing to do was to not charge them. But in general, the parents thought that we handled it very well.
Good, good. Anything else in your, whether it be your policies that you will do, or any way that you, you know, you identified or worked with the situation or worked with the press, you felt that it went as good as it could?
Yeah, I mean, fortunately, you know, I'm a former CEO. It's not the first time for me in front of the press, and
Sure.
you know, I'm not tooting my own horn, but it didn't really upset my apple cart that much. But I realized that had I not been around and I had to have my center director get there in front of the cameras, it would have been a different outcome. So you just have to be prepared. And that's the other thing I would do differently is, you know, we have an emergency response type plan for sort of general type emergencies. But, you know, since that time now, you know, we've written a separate little COVID plan that says this is what's going to happen. This is where the questions go. This is who's going to appear before the media. These are the issues for the parents. This is who calls who. that kind of stuff. So I would say I would try to be better prepared for this to happen again.
Well, that's, that's great. Any additional lessons learned that you would like to impart on to the peers that are on our call?
No, I think the most important thing is to, try to be sensitive to what the parents are feeling, but also you need to make them aware that you're running a business and that despite the fact that you will do everything possible to safeguard their children, that you can't eliminate this risk. All you can do is minimize it and make sure that the parents are comfortable. And just like the person said before, we only lost 6 families, but there's 6 that I probably wanted to lose. There's 6 that were Uber parents, on the phone, on the video, calling 3 times a day. They were, so the ones that left, it was no shock to us that those families left. And we've been backfilling those spots. So I don't think it'll have a long-term effect.
Well, good. Well, I'm happy for you that you guys didn't have a long-term impact. And, I think, a lot of the things that you're talking about, being prepared for it, having a plan, and, having an upfront ability to have an open communication with parents so they know what to expect from you, and I think is really helpful. So congratulations on handling it as well as you did for a tough situation.
Thank you.
Hey, thanks so much, Herb. I'm going to have Francis jump on now. And Herb, thank you so much. So Francis, if you don't mind popping on, do appreciate it. And Herb, if you don't mind, I'll ask you to minimize your video. And then we'll go ahead. And Francis, how are you?
I'm great. How are you?
Well, good. I haven't seen you in a little bit, but I always enjoy seeing you.
It's been busy.
Yeah, I'm sure it
just
has.
a little bit of, huh?
No, I was just going to say, tell us just a little bit about you and the centers that you run.
Well, I oversee 7 locations here in Richmond, Virginia, and been with the same company for it'll be 30 years in September, and it's just a mom and pop, locally owned and operated. We have about 1,500 children between the 7 centers and close to 200 employees. So we have had 2 cases of COVID, one at one school and one at another. So the first one we did learn quite a bit from, and we don't allow the parents in the building, so we're doing the temperature checks and all of that and grabbing the children at the curb and taking them straight to the classrooms. With this first incident, the parents both were symptomatic, went to get tested, and continue to bring their infant child to us daily.
Well, they thought that they possibly had it.
Yes, they were symptomatic. They had temperatures, they had the sniffles, the coughs, the whole 9 yards. So for 1 week, this child came to our care, and when their results came back, they called us. They'd already dropped the baby off to us. They called us to say that mom said, I'm symptomatic, I've tested positive, we've had symptoms, dad results should be back today. And I said, the director said, well, you're gonna have to come get your child. And the child never had any signs or symptoms, so let me just be clear with that. So they got really upset with us. But prior to that, we sent out a note saying, please let us know if you've come in contact with showing signs and symptoms, so on and so forth.
So Francis, let me ask you, they were upset with you because you asked them to pick up, because they were COVID positive. She said she was COVID positive, and you kindly asked her to pick up her child.
To take her baby to get tested.
To get tested, and she got upset.
Oh, yeah, it got really nasty with them, like the very next week as well, yes. To the point where they tried to blame us for the child ended up testing positive. Let me just be clear. And then they tried to blame it on us. So, but we have all of our records for everything. So, so she went to, the baby left. We did not send an email out to our parents. And at this particular location, at that time, I have about 125 families at that time. We did not want it to get turned over to the media or get leaked to the press. So we called every single family to let them know which I'm glad we did, because I did it the next time as well, because we did not get overwhelmed with emails or phone calls. So we were able to take the time all day long from, it was probably 10 in the morning that it happened, all the way up till after 6. We were calling families, talking to them, answering their questions, going over our protocols, and all of the above. But before that, I called the health department, and I had to have, of course, I called all the infant children first. They had to get picked up, and they had to quarantine for 14 days.
So you did you basically close that room for 14 days?
Yeah, we had to close that room for 14 days complete. And of course, we didn't charge tuition because the baby was asymptomatic, and you're in an infant room where, yes, the teachers are washing their hands, they're doing everything they're supposed to, but you pick up this baby and go pick up another baby. You know, you just
Sure.
can't take. So anyway, they had to quarantine, and I recommended that they call their pediatrician to see what they recommend. But none of them, maybe one went to get tested, but the rest they didn't. So
Did anybody else in that room come down with COVID?
nope. There were 7 teachers that I had to quarantine, and because there's 2 teachers in there in the morning and then 2 teachers in the afternoon, but then you have teachers that go in to give bathroom breaks or help when there's, you know, children crying. So anybody in our health department did say anybody in contact with the child for more than 15 minutes needed to be quarantined.
Okay. How did your staff deal with the situation at that location?
Good point. I had one teacher, she's quit. She was a long-term employee. She's just like, I'm uncomfortable. And I don't want to say she's elderly. I mean, she's just in her 50s, but she's like worried about getting this, and you know, it's just too close to home for her.
Right.
So we did lose an employee, but nobody tested positive. The rest of them were okay. I mean, I paid them to sit home for, you know, 14 days.
Right. So tell us about the other center. What happened at your other center?
That other center, the child was asymptomatic as well, but the parents went to go on vacation to Boston and had to get checked before they could come in, and mom tested positive, and the whole family was asymptomatic. The child did not test positive, but she called, and because the child was there, again, I went ahead, and this was in a young toddler room. The child was 2, but it was a young toddler room. So we went ahead, I called the health department and told them what I was going to do. We ended up just closing that classroom for 1 whole week.
Okay.
Because the child hadn't been there the week before.
Right.
But the health department then called back and said, well, you didn't need to do that because the child hasn't been there for the week before. But because the child was asymptomatic, I only needed to close that classroom for 48 hours. Or no, the child was only, could have given it to the other children 48 hours before he or she tested positive. It was crazy, but
Okay.
I'm like, no, we shut the room down and did a thorough clean, so.
Wow. Okay. And with that situation, how did the relationship with the parents go for that one?
The second one, it was fine, except for one parent, which was a parent from an ugly divorce. We couldn't get mom at the time, so we reached out and we did talk to dad. We, again, called every family in that location in the school, called the children that may have come in contact first. She was mad. We hadn't made it back around to the divorced parents yet. We went contact parent number 1 first. She was mad, threatened to call the news. She did call our licensing representative, made a complaint on us. Yeah, but everybody else, fine.
Okay.
Because
and how
we were there.
Yeah. When you say
to
you were
talk to them
there,
immediately.
so because you immediately made yourself available, you're immediately calling everybody. You didn't send out notes, but you just made one-to-one contacts.
With every single, at both of those locations, yes. Because then we're able to read the parents' fear. You're able to ask any questions that they may have had. And they were really appreciative because we took the time to personally call them. And they were like, has my child been in contact with this child? Or what are your protocols? You could spend 30 minutes on the phone with just one parent, but you're there to ease their fear, is what we do.
Sure. And from the time you found out to the time you communicated to the parents, how long of a span of time was that? I know in between, sounds like you in both situations, you talked to the Department of Health, Francis.
Yeah. As soon as we found out, I called the Department of Health. The very first time I put an urgency on it, and I kept calling them back if I didn't hear within 30 minutes, because I'm like, look, this is a young baby. And in that particular classroom, I have another baby that has a heart condition. So I was freaking out, as the parents did in that class. So I got to talk to the doctor at the health department that time, and he called me back and he was reassuring. So it was within hours of me finding out, talking to the health department, and then we're calling parents.
Right. And did either one of did this situation hit the press at all, or media?
No. The one mom threatened, but it didn't happen. And I mean, I called her, it's like, you can call the press, but I'm not sure, what are you going to say? We've done everything. We're contacting you all. And we've worked with you guys in a crisis situation before, so I kind of already had that PR news statement ready to go.
Good. I'm glad, Francis. I'm unfortunate. I hate to see when you have to use it.
Yeah, I mean, so we had something ready, and unfortunately, that's because we went through a crisis before and used you all, and it was great. So.
No, thank you very much. What would you do different? If anything, you've gone through it twice now, so because I hate to say it's becoming old hat, but as we all know, this is titled not if, but when.
It is, and it's going to be, again, I'm sure. This time I'm making, the letter we sent out to the parents months ago saying, hey, let us know if you have signs, symptoms, whatever. I made it now that they sign it and give it to us, so we have a signed copy in the file. But I feel like it's something we need to send out monthly just to remind parents, because it had been probably 2 months since we sent out the initial communication to them. And
Yep.
We all get kind of complacent with where we're at. Or forget to, like these parents, they knew what they were doing. But again, I just want to remind everyone
No, that's a great point.
continue, because you just forget. I mean,
Yeah.
this is our new norm, and it's like, but yeah, I think on a monthly we're going to send it out. Just a reminder.
Sure. Anything else you
takes a
would do
village.
differently? Yeah. Anything else differently with the families, with the staff, the way you managed the issue?
Well, I did not let that particular family come back.
Okay.
I didn't. I felt like they knew what they were doing, and it was only, and that was my director and my staff members' fear as well. Like, they used us, and they just felt betrayed and hurt, so they did not come back. The other thing we're doing though differently is, because we had to stop and think, who went into that classroom to give bathroom breaks, or was somebody sick during this time frame? And we have a schedule and who goes in if somebody's sick or whatever, but I have narrowed it down to say these teachers especially babies, only these teachers can go in and give the bathroom breaks, because you're in there holding those children. It may be different for a school age classroom when you go in to give another teacher a bathroom break, and you're only in there for 5 minutes. But if you're in the baby bird room, in the infant room, you go in, you may pick up the baby and start feeding them while the teacher, you're giving 2 or 3 teachers a bathroom break. So knowing who goes in and out of those classrooms is important.
Right. Well, good. Is anything else that you would do different before a couple lessons learned?
Just that, keeping track of that, and keeping track of the teachers that go in for the bathroom breaks, and just reminding the parents. I mean, that was the big thing, is I felt like if we continue to communicate, whereas before we over communicated at the beginning of COVID, we over communicated, and now we're under communicating, so we have to pick that back up.
Really good point. Anything else? Any other lessons learned?
No, Not that I can think of. I mean, honestly, having that press release ready just in case the parent did call,
Right.
and having that already ready, having the director, the assistant director, everybody was ready for just in case the news showed up at our door that afternoon or the next day. We were ready for them. So if you don't have it, like, again, it can happen, and this happened on a Monday morning, and you're like, woo, everything else is going on, but not having to worry about having that ready, it was a good thing.
Well, Frances, thank you so much. I really appreciate you taking some time. As I ask Charlotte to come on, Frances, you guys already had 2. Hopefully you do not have to have another one, especially in the near future.
I hope not.
So thank you so much. And if
Thank you.
Charlotte, if you want to pop on, thank you so much, Frances.
Thank you.
And asking Charlotte to join us. I think she's had a couple little internet issues, so hopefully Charlotte's been able to pop back on. Let me see, give her a moment.
Can you hear me?
I can hear you. I just can't see you.
I think you may have turned off my video earlier so you may have the control.
Oh, that's horrible that I did something like that. Let me see if I could pop you back on. How about now?
Okay,
There
here
you
I
go.
am.
There we go. We got you. So maybe I was horrible with that. Well, welcome, Charlotte. So Charlotte, just if you don't mind, just give a little bit of background. And I know that you and I've done a lot of work together over the past several years. So if you could just help out everybody, just know a little bit about you.
Sure. I've been a part of the IC360 team for the past few years, leading crisis communication work. That's part of membership. So members do have that ability to fill out a form and request crisis communications counsel. Prior to helping with that, I've spent most of my PR career in higher education communications and had a lot of crises there. And prior to that, I started my career in TV news. So I was on the other side of the spectrum.
Wow. Yeah. And well, you're such a great communicator as it is. So I've already learned a lot from you too. And
Thank you.
It's great. What do you think about our 3 panelists and what's been going on? What are your thoughts?
I'm really impressed with the way they all responded to the crisis when it happened, especially the person who just spoke, who talked about being prepared and having a statement ready to go in the event that the media would call or contact them. I think that's very important. I think the initial inclination when a crisis hits is to go silent, and that's a normal response. However, time is of the essence, and if you don't respond with your key messages, someone else will fill that void for you, and those who do may not be accurate. So time is of the essence, and you really have to get your message across to your key stakeholders quickly.
Yeah. And one of the things I heard a lot from Kim, from Herb, and also from Frances was a level of candor and transparency. Tell me a little bit about your thoughts when it gets to those elements, because oftentimes, I know when I've had with my center, I've had some kind of a crisis go on. You really are almost doing a dance of how much you say about what until, whatever might be the risk situation.
I think ongoing communication with your key stakeholders is very important. You may have a variety of vehicles where you can be communicating with them all along to alleviate some of the fears that they already have about COVID and how you're handling it when things are open. So especially when schools reopen, I think there's a lot of fear around that. So if you have revised your policies at all and you have, say for instance, you have upgraded your cleanliness or your desanitizing and all of that kind of thing, you need to let your families know so that they are then less fearful about sending their child in. I think, of course, safety is always the main message you want to get across to your families, that the safety of their children while they're in your care is of the utmost importance. And here's what we're doing to ensure that they are safe while they're here.
So, and thanks for going into that. There's 3 different constituents that I typically see that we tend to address. There's the media or the press, there's our families, and then there's our staff. You started talking a little bit about the safety for the families and what have you. When you talk about being prepared for the families, realistically, ahead of time, I think we heard some really good stuff that some people like Francis was communicating ahead of time
Mhm.
and being out there, and Herb had been really quick to get directly to it. Kim also did some immediate communications. What do you think is critical when you talk about family communication?
I think that first of all, to let them know that safety is of the utmost importance and that you're on top of this. You're in touch with the health department. Should you get a report of a case, you're immediately calling the health department, aligning yourself with them and their guidelines. Here's what we've done to increase our cleanliness and to help prevent illness from happening. But if it does happen, here's what we're going to do. I think it's good to communicate with your families as much as possible, again, to alleviate a lot of the fear and concerns that they do have. And then if a crisis does hit, they know you're on top of it and you're going to have open communication with them about it. And that
Right.
goes for your internal stakeholders as well, your staff. They want to know as much as the families want to know that the leadership of the center or the school is going to go through the protocols and make sure everybody is safe, all of the stakeholders.
Right, and thanks. And with the press, we had a question asked. If you are preparing a press release for, ahead of time, like if, one of the takeaways from this is our peers who are on the call says, you know what, I want to get that down. What are sort of the key things that they should be thinking about when they're creating a press release?
I would say to keep it short. Very often a statement to the media will suffice. You don't always have to give an on-camera interview or a phone interview if you prefer not to. A written statement will often suffice, and it should be short. We had a case, for instance, we had a case of COVID at the center. We were in close contact with the Department of Health. We're following all of the guidelines. We closed off the classroom. We notified all of our parents. We've been in close contact with our families, and we will closely monitor this situation moving forward and provide any updates as needed. I mean, that's usually enough to get people to understand, yes, we had an issue. We're on top of it. We're handling it. We've notified everybody. And of course, you want to give concern for the person that has the illness, that we wish them the very best and a good health and hope that they will recover and be fine.
And I'm really glad you brought that last up. So I haven't had a COVID case at my centers, but you'll remember this, about a year and a half, almost 2 years ago, we had one of our younger teachers come down with hepatitis A.
Right.
And hepatitis A is a highly transmittable disease. And it is something that can be highly transmitted and also left untreated. It can cause, paralysis up to death, and it can be significant. It also is something that there is a vaccine for, within a certain amount of time. When that had hit, we had found out, actually the Department of Health called us. We had the Department of Health call us and say, hey, you have a teacher who has this. And strangely enough, this is well before COVID times. The Department of Health told us, don't send anything out to anybody until we tell you to.
Mm-hmm.
I went against that because I was like, no, my staff and my families need to know. This is about their health and safety. But I did engage my own Charlotte here and her team, and we worked hand in hand. And a lot of things that Charlotte is talking about are things that we did. We talked about that we were working in lockstep, which we were, from exactly what the Department of Health was asking us to do. We were doing everything to ensure everybody's safety. We also made arrangements for vaccinations and things of that nature for everybody. And, first and foremost, we were like, our hearts go out to our teacher, who's actually the one who's really suffering about this. So we handle that. So it is a very trying situation. Let me ask you one more question before we sort of start to, wrap up on this. And let's say, though, that you do have a situation like Herb mentioned, you know, the press got a hold of it, had sort of a parent who sort of slipped it to the press.
Mhm.
And I think we know too, you know, you've been in the press. Sometimes the press take what you say. Other times, especially when it comes to childcare, there's an opportunity to sensationalize it because they know that unfortunately that sells. You know, when you do find an issue where, you know, I guess to say the cliche, you know, a member of the press take it as a dog with a bone. They just sort of want to make it, sensationalize it. What are your thoughts about managing through something of that nature?
Well, I would say, first of all, timeliness is of the essence. You've got to get a statement together for the media to assuage them and to have your side of the story hopefully come through in the story. But also that, you don't have to do an interview if they're on your doorstep. You can. But if you do, you should have 2 to 3 key messages that you want to get across. And those should be revolving around safety, compliance, monitoring. So those are the top 3 things I think that people should keep in mind when you're talking to the media, and keep going back to your key messages. You know, if you know you're going to be giving an interview with the media, I would practice. Get those key messages written down, have a little script. You don't have to bring it into the interview, but at least have it in your mind so that when you do the interview, you have those top 3 key messages that you keep going back to. Now, media, we know, will try to get you to go off into other directions. But I think there are ways to bring it back to your key messages by saying, that's interesting, but what we want people to know is this. Boom, 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 your top 3 messages. That's an interesting perspective, but what's most important to remember is A, the safety of our students or our children in our care is of the utmost importance. B, we're working closely with the Department of Health to take care of the situation. And C, we're monitoring, and we will be communicating with our key stakeholders as we have updates.
Yeah, and what I've learned from you over time too is and Herb made mention of this too, and I'm a big proponent of it. Education to your entire staff about if they were to be contacted with the media, that you already have a plan.
Yes.
You have a means that they understand who does talk to the media and who doesn't. There's a big difference from a teacher saying, I'm not the right person to comment on that, but I will get you a name of who you could and pass it on to the owner or up the chain, as to them just saying no comment, or the fact of just making a comment on the side or making a comment on social media.
Right.
So
there should be one spokesperson for the organization and one statement, and
right.
and no one else should be speaking to the media on the organization's behalf.
Yeah. So in summary, what I've heard through a lot of these conversations is oftentimes there's a lot of confusion that's going on. It is not easy. It is a fire drill. There's a lot of sensitivity, but being transparent. It's okay to communicate that you're running a business and to have an ongoing communication. Also sending out monthly updates about what your policies are, what if situations, if this happens, what we'll do. That's what my centers do, is we've already put out a plan to all of our families saying, if this happens, this is what we're going to do. But we also know, just like it was mentioned, I think by Kim or Francis, that a lot of times parents don't read all the time. So we have a look at that, looking at finding out who is coming in and out of classrooms. Some of them are doing it manually, some are using video for it. Also with what Charlotte was just talking about, press releases, and talk about safety, talk about compliance, and talking about monitoring. So, one of the things for those who are unaware with your IC360 membership too, is we do have, Charlotte is part of that team of our PR crisis support. The other thing is we do provide a handbook, and a handbook template, that is, and also training. So that means that as part of the membership, that it's important, if you don't have it, to work with Jen Guadioso, so you get yours as part of it, where you make sure that you have your handbook, you have your plan. That handbook's basically a plan for your staff and your admin. Your training is also for how your staff and your admin should deal with situations in case a crisis came up. And it is really important because, as Charlotte mentioned on the front end, is there's an opportunity that, speed is really important. So IC360 is there for you. Charlotte and her team are there for you. And it's really important that we try to stay ahead of this, because being proactive is 1,000% more important oftentimes than just responding with a little bit of a panic. Charlotte, do you have any more thoughts or questions before we move on?
One more thought, if a lot of people are not reading a newsletter, you might consider doing short videos for social media, where your director is basically speaking the message that you would have included in the newsletter. And that's another great vehicle. Most people are on social media and they do watch those videos. So the key is to keep it short.
Yeah, keeping it short and sweet. And when you say short, how long is short to you?
I would say 30 seconds or under.
Okay, great. 'Cause some people might think that's 5 minutes. So I'm glad you said
Yeah,
that.
I mean, very, very basic message that you want to get across.
Well, wonderful. Well, Charlotte, thank you very much for also joining us in this. So just in review for everybody, I want to thank everybody for coming today on our town hall. A couple elements about this. The replay is available for all of you. There are a number of questions that were asked. We are going to try to go ahead and get those answered for everybody. If for some reason we didn't have them answered already, but there was a number that were answered. If you do have any other questions, do not hesitate to send them to us and reach out to us, and we'll try to do what we can to be helpful with sessions like this and any other. So thanks to Kim, thanks to Herb, thank you Francis, and thank you Charlotte for joining us today. We'd like to thank everybody for joining us for our session, and we'll look forward to seeing you again at our next executive pop-up webinar session. And hopefully we'll have a very topical meeting that's not as intense as COVID. Thank you, everybody, and have a wonderful day.